students? Thank you, Chair. Thank you, Secretary of State. And I'm particularly interested in the removing bureaucracy and red tape aspects. When Simon Stevens came, he welcomed the changes that you're putting forward, and he split those into the administrative side and the frontline side. On the administrative side, you've got rid of competitive tendering, which the NHS is very pleased about. You've talked about how much that will save. Are you able to give us a figure of how much we're likely to save with those changes?
I don't have an exact cash figure for those savings. It will depend on how effectively people will be able to improve their procurement because of the reduction in bureaucracy around it, as well as, of course, the direct cost of the bureaucracy that's being
Would you
removed.
be able to write to us with those figures, even if they're an estimate? Because I think that's really useful to see how much of a difference it would make.
I'd be very happy to.
And on the second side, the frontline side, do you have a feeling of what these changes will make as a difference to red tape and bureaucracy for those in the wards or in the GP practices?
Yes, because we've already seen some of that during the pandemic. So, for instance, the radical simplification in the data protection guidance that we put out in April, I think it was last year, has been warmly welcomed across the system. Because previously it was incredibly convoluted, and we simply said, protect patients' data, but use modern techniques if you want to. So you can, of course, you can WhatsApp, so long as you use WhatsApp appropriately. And what matters is the protection of the data. That's just one example which we were able to do on a secondary legislation basis. And there's a whole load more of.
And I'm really keen you picked up on that one, because that you mentioned in your start when you talked about this gives accountability, and I'm keen to see accountability at the front line, because often lots of doctors, nurses, receptionists have great ideas but have no power to change it. And I wonder if there's a way to legislate to put them in a position of power. We have a named advocate for GDPR reasons. We have a named advocate for whistleblowing. Is there a case to have a named person for change where they are brought forward and protected in law to allow them to suggest ideas that would have to be mandatorily picked up and considered by those above them? That drives change from the front that can hopefully unleash some of the potential that we've seen happen in the pandemic.
That's another excellent idea. How we operationalize that will be complicated, but I'm very happy to work with the committee on it.
And one final question. One of the biggest things I saw practicing as a GP is the integration or lack thereof between primary care IT and secondary care IT. And you talk about bureaucracy and data in the white paper. Is there an IT roadmap that you will be producing to allow that integration to happen? Because fundamentally, that is one of the biggest problems that we have. We now don't have fax machines, but we pay someone to scan in letters that are sent. This seems bizarre in this 21st century.
Yes, in fact, I was due to be giving a speech on this right now before the Select Committee request came in, but I'm giving it on Thursday instead. And we are coming forward with more details in this area. There will be clauses in the bill to help improve the interoperability of data, which is incredibly important, and not just between primary and secondary care, although that is critical, but across the board. There's a lot of work to do in this space. The NHS has made big strides. NHS Digital has done a great job. The leadership of NHS X in setting this out strategically has been important. And again, we're learning from the vaccines rollout, where this data architecture got sorted at the start. Thank goodness, because we went into it actively writing a clean data architecture, so we know who's been vaccinated. We can get that back to their GP record, and then we can call people for their second dose at the right time as well. So this is absolutely critical, and we should learn again from the vaccine rollout.
Thank you very much, Chair.
Thank you. And last but